to Spotlight. I'm Karen Polka, and I'll be speaking with Joes, the CEO from Lake Huron Medical Center. Today's show is sponsored by Semco Energy Gas Company. Welcome, Joes, to Spotlight.
Thank you.
So everyone needs medical care at some point. And with Lake Huron Medical Center, you have some things as a CEO that you'd like to share as updates.
That's correct, Karen. Thank you for giving me this opportunity to come and talk at the Spotlight. So at Lake Huron Medical Center, we provide not only the day-to-day care for our patients, but also we look at preventative kind of care. We strongly believe that it is important for us to educate or provide that prevention of care, prevention of diseases to our community right here. So that is one of the strategies we have developed, since the COVID has gone away, because even during the COVID time, we actually implemented a drive-through COVID testing program for our patients and families in the community and also for providers. That is one of the immediate innovative kind of an idea we came up with, because a lot of our physicians in the community was reluctant to bring patients into their offices because of the fear of spreading those diseases. So they came to us and said, what can we do to like a screen or kind of test these patients before they come to the offices? So we came up with this idea of a drive-through testing program for COVID patients, and we were able to provide that support to our physicians in the community. So that was the beginning of thinking about these kind of innovative ideas. Then, we had some history with, providing preventative care, like diabetic screening programs in terms of doing the mammography testing, and also calcium scoring, lung cancer screening, and skin cancer testing. Those kind of things we have been doing it. But we have an increased focus now to do those kind of things. Next month, we are collaborating with our People's Clinic to provide mammograms, 3D mammograms. Now we have actually purchased a new 3D mammogram in addition to what we have, one in the North Campus. So now we have 2 3D mammograms providing testing for women in our community for prevention kind of cancer prevention kind of programs. So what we have collaborated with our People's Clinic is that it is important to bring care to the people who are not able to afford that kind of testing.
Sure.
So People's Clinic is providing the support to subsidize those care or testing for those women. So we want to make sure that everybody in the community have an opportunity to do the mammograms and make sure that they are actually taking all precautions from getting breast cancer.
Right, having a baseline sometimes
exactly.
is as simple as that.
That's correct.
Preventative care is also such a cost saver overall.
That's correct. In the long run, it is going to not only save the cost, but also quality of life for the people to do that. And also some people who have issues related to hereditary or any kind of issues, they can actually have the peace of mind, and the quality of life goes up too, making sure that these kind of tests can prevent them from having breast cancer in the long run kind of thing. So we want to make sure that it is not only for people who have insurances, but also people who don't have insurances or people who are underinsured. Though everybody need to get a breast mammogram. Cost shouldn't be an issue for getting a mammogram. That's our goal. So I encourage even our own healthcare staff to get the testing done. We have encouraged our managers, give them some time to go do the testing.
Okay.
We will make it available to them because it's right there.
Right.
So especially with healthcare, most of our healthcare employees, probably 60 to 70% of our women, and they and their family members, if it is men, their spouses should actually get the mammogram. So, we have actually encouraged our leaders to communicate that to our employees to make sure that they get that mammogram done in the next month. That's what a breast cancer awareness month is, October. So we want to push that a little bit stronger.
And so with the People's Clinic, the innovation that you're providing our community is really important, and it's really progressive. I love innovators.
Yeah.
But the People's Clinic, what kind of qualifications, how can someone come and, where is it located?
Yeah. People's Clinic is actually located at the Community Mental Health Building, right on Port Huron. So what they do is that they actually have clinics every day of the week, and there is a provider there who will actually take any kind of patients. If patients don't have insurance, we will take them. If people have insurance, they will take them. If they have Medicaid, Medicare, or any of those kind of things, they take care of them, and they provide the needed care for those patients at that point. Now, in addition to that, with assistance from Port Huron, City of Port Huron, we are actually going to purchase a mobile clinic which can go out to the underserved communities in our town and do the screening for our patients and see that, okay, if there is a healthcare need, we provide them, we are actually taking care to them rather than patients coming to us kind of things.
Right.
Because one of the stigmas about patients is that, if there are patients who are patients who live in underserved communities, or people who are not able to afford their care, they are the ones it is harder for them to get a ride or a bus ride or any of those kind of things and coming to the clinic. So what we are doing is that we are actually going to them with the support, with the Port Huron City to have this mobile clinic through People's Clinic. We go to them and screen those patients and help them to integrate into the healthcare system. That's what we are trying to do.
Well, Lake Huron Medical Center is really doing some wonderful things here in St. Clair County. So
appreciate that.
Thank you so much for joining us today.
Yeah, appreciate that. Thank you.
And thank you for joining us on Spotlight.